Hit record. So thank you so much for being here. It's Megan Jansen, owner of Employee Wellness Solutions Network. I'm very excited to be able to share our first family wellness webinar of 2019. And it's on a very exciting topic and very timely, seasonal affective disorder. And just to go over a couple of the ground rules, so to speak, in terms of keeping things flowing tonight. Everybody is muted, and if you can or can't hear me, hopefully one of you would mind just sending us a Q&A or a chat in the bottom of your box to make sure the audio is okay. That would be wonderful. Secondly, as you do see on your box, there is an opportunity to ask questions through the Q&A or through the chat box, and we will be monitoring those for you. So absolutely keep those questions coming throughout the presentation, and we will be able to answer those. If Cheryl is going to answer your question throughout her presentation, she may ask for that to be answered at the very end. So we will make sure that we do have an opportunity to get all of your questions answered. We are recording that, and we are going to be offering the recording afterwards. So if you do have any questions or any content you'd like to check again, feel free to do that. So without further ado, what I would like to do is introduce our co-host, Sherry Denemy. Sherry is a health promotion student from Centennial College. And Sherry, if I may ask you to introduce Cheryl and read her bio by introduction, that would be wonderful.
Thank you very much, Megan. So I just want to welcome everyone. I have the pleasure of introducing our presenter tonight, Cheryl Leggett. Cheryl's a very passionate mental health professional with more than 20 years of experience in frontline social services, working in a multitude of settings with diverse populations. She has worked extensively with employers around workplace wellness, with healthcare professionals, clinicians, emergency service personnel, treatment facilities, volunteers, and various community-based organizations throughout her career. She has experience in nonprofit leadership, management, frontline crisis response, suicide intervention, crisis intervention training, workshop facilitation, and community engagement. Cheryl is a strong advocate in promoting mental wellness, reducing the stigma that surrounds mental illness, and believes that every person benefits from receiving basic education on the signs and symptoms of mental health concerns. She's a skilled professional and highly sought-after facilitator and trainer. She has successfully delivered hundreds of presentations, workshops, and customized training sessions to individuals and groups in Canada. So without further ado, I'll just turn that over to Cheryl. Thank you.
Great. Thank you so much, everyone, and Sherry for introducing me. And welcome, everyone. I'm happy to have you all here on this really important topic tonight in this family wellness webinar on seasonal affective disorder, otherwise known as SAD. So tonight, we're going to go through a number of different things as we talk about this. We are going to touch on, as you'll see here, we're going to talk about what is seasonal affective disorder. We're going to look at the signs and symptoms. We're going to look at how it differs from major depression or clinical depression. We'll look at the causes and the risk factors that are come along with seasonal affective disorder. We'll look at a few of the myths and the facts around depression. We'll look at how you can manage seasonal affective disorder. We'll look at treatment options, self-care tips at the end, and then we will look at some resources for support and places that you can reach out to. Okay. So as you see here, nice little slide that's going to set us up for our topic. And for anyone who suffers from seasonal affective disorder, this probably isn't a very good sign. Okay, so let's take a look at what is seasonal affective disorder. It is a depression. It's a type of depression that happens specifically during seasons. It usually will come on about the same time each year. The same symptoms develop. And when we look at seasonal affective disorder, again, in order to be diagnosed with the disorder, you need to have this occurring for at least 2 years in a row. Okay, it can happen in winter. It can also happen in summer for some people, and we'll talk a little bit more about that. Okay, seasonal affective disorder is not new. We're hearing a lot more about it now as we start to talk more about mental health and mental health concerns. People have always, throughout history, had low energy when we have lack of sunlight. People have a depressed mood. If we think about animals, and those animals that hibernate during the winter, we're not all that different as humans. When we start to lose those sunlight hours and the days get shorter, it's not unusual for people to want to hibernate, just like animals do. Stay indoors, not be as effective, kind of, pull the covers up over your head and stay in bed. So in the 1980s, it was given a diagnosis by an individual who came to America, or came to North America, and started to feel low mood in the winter, and had moved here actually from Africa, and wondered why in the various seasons of winter he wasn't himself. So he did some research, and he started to come up with reasons, and it has to do with chemical imbalances in our brain, looking at what was causing seasonal affective disorder. So again, not something new, but we're definitely starting to recognize it a little bit more. Okay. So if we look at overall feelings of sadness, right? And there's what we call winter blues. In the wintertime, again, many of us will feel low. Particularly, we think about the shorter days starting to take place in September, October, November. We get into Christmas season. After Christmas, we're hitting the January, February. We start to feel maybe like the holidays weren't, what we wanted them to be. Financial reality starts to set in. Those visa bills start to come in. We can just naturally start to feel like just down, right? Things are happening. Again, we make New Year's resolutions. We think we're going to be on this great path of wellness, and that doesn't always take place for some of us. So those are what we would call kind of winter blues, perhaps normal sadness that we feel. That is not considered seasonal affective disorder, and it's not depression. We have setbacks in life. We have things that happen to us where, again, we don't always feel our best, but that doesn't mean that we experience seasonal affective disorder, okay? We know that many of the symptoms are the same for those who do experience seasonal affective disorder and a clinical depression, but they do vary significantly from person to person, both in severity and in length. So no two people will experience the same thing in these winter months. Okay. So if we look at some of those signs and symptoms of seasonal affective disorder, and I'm not sure how many people on the webinar are familiar with depression, we do know that many of the symptoms are going to be the same. As I mentioned earlier, with seasonal affective disorder, it's going to be, starting in around October, November, people are going to start to feel quite low. It worsens over the winter months, and those months between kind of, November and February tend to be the worst for people. Once the daylight hours start to come back, people will start to feel better. But overall, the symptoms are very similar to what we might experience with regular depression or a depressive disorder, which could be associated with bipolar disorder or just depression in general. So we might start feeling very anxious. having a loss of interest in things that you once enjoyed, so not wanting to participate in usual activities. You might experience that withdrawal, isolation, again, just not wanting to connect with people that you would normally be connected with. You start to isolate yourself. You might find yourself not going out. You might find yourself taking more time off of work, or perhaps this can be school, okay, when younger people experience seasonal affective disorder. One of the key components to seasonal affective disorder is eating more, really craving those carbohydrates and sugar, which can cause weight gain in those winter months, sleeping more, and still feeling very, very tired, just really low energy and low mood. Those are the two things that really come on with seasonal affective disorder. And as I said, eating more, having trouble concentrating, difficulty carrying through those daily activities. Again, and that can be in work, that can be in school, that can be in social, with relationships, just really feeling like you're just not yourself. You might start to have negative self-talk, thinking that you are no good, that you can't do anything right, that, you've got feelings of helplessness and hopelessness, feeling very worthless, maybe guilty. This can all lead to thoughts of suicide. We call these cognitive thinking distortions, where all of that negative self-talk really has an impact on our self-esteem. And when we have those thinking distortions, again, we tend to believe those thoughts that ruminate in our head, the ones that we repeat over and over again. And as indicated, sometimes those thoughts can lead to suicide. So let's take a look at, again, we're still looking at the symptoms of seasonal affective disorder, and many people aren't aware that it can impact people in the summer months. We've looked at what winter seasonal affective disorder can look like. Summer seasonal affective disorder is quite the opposite, in that with those increased daylight hours, people might find it very difficult to sleep. So they start to experience insomnia, not eating a lot with the heat and with everything else that comes on. People don't feel very well. They start to become irritable, and again, might start withdrawing from social events. They're watching everybody else around them participating in, going to the beach and having family vacations, and they don't understand why they're not feeling the same way. And again, it comes with those the changes in the brain activity that's going on. So in the winter, what happens is that the body produces less, the brain produces less serotonin, which is a feel-good mood, and produces more melatonin, which causes us to feel sleepy. So that's what's happening in the winter. And in the summer months, we're actually producing more serotonin. It's supposed to be that feel-good energy that we have, but we are actually not sleeping. In fact, one person described the summer months as being increasingly difficult because she wasn't sleeping, up all night. The extensive daylight hours were causing her to be irritable, and again, the next day not being able to manage through those daily routines. So having difficulty just participating and getting up and going to work. So very much like the winter seasonal affective disorder, people can experience it in the summer as well.
Cheryl, this is Megan Jansen speaking. We did have a question come in actually about this. Yep. There was a question that came in around, does this also happen, both the winter SAD and the summer SAD? Can that happen in children?
It can happen in children, and we are going to touch a little bit on that coming up here in the next couple of slides. Okay, so if we look again at the difference between seasonal affective disorder and major depressive disorder, that overall feeling of sad mood and low energy is one of the main things that comes along with seasonal affective disorder. And we looked at the other symptoms of clinical depression, and that's also present. One of the things that might be different with seasonal affective disorder is having a very, very heavy feeling, like a leaden feeling in your arms and your legs, again, which can make it very, very difficult to, you sort of feel like you're just moving along and kind of at a shuffling pace. A lot of the times you just feel really heavy, and that can be one of the differences in major depressive disorder, with seasonal affective disorder as opposed to major depressive disorder. And when I talk about major depressive disorder, that is anything related to depression. We use the term clinical depression, we use major depressive disorder, and this is when somebody would be feeling and experiencing those signs and symptoms that we looked at: low energy, lack of motivation, withdrawal, isolation, negative self-talk, right? Feeling hopeless, feeling helpless, changes in appetite, and that can go either way. Eating too much, eating too little. It can be weight loss, it can be weight gain, sleeping too much, sleeping too little, just difficulties overall. Those symptoms would be present in somebody within a 2-week period more often than not, okay? That's how a major depressive disorder or clinical depression might be diagnosed. And what's really important to note for everyone who's on this webinar tonight is that you don't self-diagnose as we go through this. Again, many of us feel sad, we can feel blue, we have setbacks and losses, but it's really important not to do a self-diagnosis as we go through this. If you are feeling any of these symptoms or you're having any of these signs that we're talking about, and when we talk about signs and symptoms, signs are the things that are outward that people see. A symptom would be something that the individual themselves would be feeling. So we might not know, right, if somebody's having those negative self thoughts, if people are feeling really helpless and hopeless. Those are things that the individual themselves internally might be experiencing, and we might not know that that's what's going on, but we might see that excessive sadness in someone, the really low mood, the low energy, the lack of interest, again, the excessive sleeping and the low energy. All of those things would be signs. Symptoms, again, are what we would feel ourselves. Okay, so looking again at how a general practitioner, so a family doctor or a psychiatrist, might determine if somebody was experiencing seasonal affective disorder or depression, would be to look at, have you had those same signs and symptoms? Have you been depressed kind of during those same months for at least 2 years? The other key to this is, do you feel better when the season changes? So if it is, again, if you're experiencing winter seasonal affective disorder, it's going to be, when we get the daylight hours start to come on, we're starting to see a little bit of that now, longer daylight, but usually it's in and around sort of March and April into May when all of a sudden those symptoms start lifting and you start to feel better because your body is now not producing that melatonin that makes us feel sleepy and low energy. It's starting to produce the serotonin with the sunlight. Okay, so again, this is all your internal biological clock that starts to turn around, and the neurotransmitters in your brain start to, again, naturally bring on some of these, the feel-good mood, right, the serotonin. In the summer, it would be when the days start to get a little bit longer and it gets darker. People are then able to sleep where they might not be able to sleep in the summer. So with those changing seasons, the symptoms kind of dissipate. That would be a key to determining whether you have seasonal affective disorder, okay, or whether a doctor would diagnose that. Again, symptoms with seasonal affective disorder being very hungry, again, craving those sugar and carbs, that weight gain, and just wanting to sleep. Another factor that might be asked is if you have a very close relative who has seasonal affective disorder or another form of a mood disorder, which would be depression or bipolar disorder. So those are some of the key things that would be looked at in order to kind of determine if it's something that you might be experiencing. Again, it has to be for at least 2 years in a row, the same time, the same symptoms. And for some people, it's like clockwork. They know that once, October, November hits, they're going to feel low. They're going to have low energy. They're going to be, they're not going to want to do as much as they would normally be doing. And then once the season changes, they start to feel better. And as I said, it can be cyclical for a lot of people.
Cheryl, I just have one question.
Yes.
So how would someone know whether it might be seasonal affective disorder or might be just, they're feeling a little bit down because of the weather, or where it could be potentially something a little bit more like a depression or something that you talked about? When would they recognize that?
If someone is experiencing the things that we've talked about in terms of the signs and symptoms, it would be important to see your family doctor, to make that appointment and talk to your doctor about what you're experiencing. There is, in the mental health world, it's called the Diagnostic Statistical Manual, and it's a really big, thick book that has specific criteria that a practitioner would look at. If your family doctor doesn't feel that they are qualified perhaps to make that diagnosis, they might make a referral to a psychiatrist. Psychiatrist is a medical doctor who is very highly trained in mental health and mental health disorders. So they would be able to look at that, and they would, look into that manual, ask a series of questions to determine if you are experiencing, enough of those things to warrant a diagnosis of maybe depression, or is it seasonal affective disorder? And again, the key would be, do you feel better when the season changes? And does this happen at the same time each year? Do you sort of have those same symptoms? Again, winter blues, it's not uncommon. As I said right in the beginning, this isn't a new phenomenon. It's not a new illness. It's normal when we have such so few daylight hours for people to feel low overall, but not everybody experiences that. If we research shows that people who live closer to the equator, where there's more sunlight, have less incidence of seasonal affective disorder. Those who live further away from the equator experience, daylight hours, less daylight hours, or very few daylight hours in the winter months, are more likely to experience seasonal affective disorder. So again, if we're in those climates where it's very rainy, and again, very cloudy, not a lot of sunshine, those are the kind of climates where people would experience higher rates of seasonal affective disorder.
Thank you, Cheryl, for that.
Yeah, you're welcome. Okay. So what causes seasonal affective disorder? Again, we just talked about a couple of those factors that would be taken into play or taken into account when we're looking at seasonal affective disorder. Again, we know it's directly related to the changes in light, the changes in light pattern. It upsets that internal biological clock that helps control those sleep-wake patterns. Okay, again, those neurotransmitters, the serotonin, the dopamine, and again, I'm not a doctor, and I'm certainly not, up on everything as it relates to neurotransmitters and those functions in our brain, but this is what research shows. Okay, again, that serotonin is the feel-good, it's that transmitter that helps us feel good. We know that exercise increases serotonin in our brain, which is why exercise is so good for you, right? Because it gets all of those things flowing for us. Talked about overproduction of melatonin. Melatonin is a medication, an over-the-counter medication that people will often take if they do have trouble sleeping. There is an overproduction of that in our system when we hit the the lack of daylight. Okay, so that explains why people who experience seasonal affective disorder feel more tired, feel more lethargic, because they're producing melatonin. We know that sunlight produces vitamin D, again, and we lack that in the winter months. Okay, we've talked about the summer months where too much daylight can cause people to have insomnia. Okay, so seasonal affective disorder, again, in and of itself is a unique diagnosis. Okay, again, the key is that people start to feel better when they are, when the season changes. It can occur, so people can have depression. Okay, people can have bipolar, they can have other, alcoholism, bipolar, attention deficit disorder. All of those can kind of co-occur along with seasonal affective disorder. So for somebody that experiences depression already, those winter months can be extremely difficult for individuals to get things done. Again, we might start seeing more time absenteeism at work, just really difficult to function on a day-to-day basis. And again, I personally know people who literally hibernate in the winter. They don't want to get involved in very much of what's going on. It can be really hard to get them out and doing things. Okay. So looking at the risk factors here, more common, again, for people who live far away, either far north or far south from the equator. About 5 to 10% of the population will experience a form of seasonal affective disorder in the winter. About 1% of the population might experience seasonal affective disorder in the summer months. Okay, we know, again, a family history can increase the risk of depression of all kinds. Women are 4 times more likely to be diagnosed with seasonal affective disorder than men, and the onset is typically between the ages of 18 and 30. It does impact younger people at a greater rate, and not really sure why, but the older people get, the less likely it is that people are going to or at risk of developing seasonal affective disorder. Okay, so we look at women and we look at young people. One of the things that has been studied is the hormonal changes and the hormonal levels in those two demographics. So as people are, young people are developing, and we know the brain develops up to age 25, and for women, right, having those ongoing hormonal changes on a regular basis can be something that is attributed to the greater risk of developing seasonal affective disorder. Okay. So let's take a look at seasonal affective disorder in young people. It can be really difficult to diagnose, and part of the reason that it's hard is because a lot of the symptoms and a lot of the behavior that we're going to be seeing in younger people can be mistaken for just being a difficult child or, typical teenage behavior. Some of the things that might be taking place, again, is that inability to concentrate, having trouble completing assignments and staying on task. We might all of a sudden start to see grades not being as good as they once were, perhaps even failing. The individual might start withdrawing, okay, isolating themselves, have less interest in going out and socializing, coming home after school and crawling into bed or getting on the couch, right, under the covers and needing to sleep, an inability to get up in the morning. So for any parents that are on the webinar tonight, we look at this, and again, we don't want to ring any alarm bells for people, but having an understanding of what could be going on for your young person, I think, is important. A lot of the signs and symptoms of depression mimic what we might consider typical teenage behavior, okay? Laziness, lack of care, just lack of motivation within the family, just slacking in school. And again, this can be a really confusing time for the individuals themselves, for the parents, for the teachers, and for everybody that surrounds that person. So I think it's something to just take note of. If you're seeing those changes, again, keeping in mind that it's going to be the same kind of thing at this time of year, right? When the winter months are here, that your young person is just having more difficult overall in day-to-day activities, maybe not wanting to participate in family outings, not wanting to complete tasks in the home. Taking a look at that, again, because we often mistake it and we just think that, you know, the child is just being difficult, or that we might think that they're starting to partake in drug use or other substances. And this is what, in fact, could be happening. And the onset of depression usually starts in the teenage years. And a lot of people aren't aware of that, which is why it often goes undiagnosed. And many times it's well into the 30s, late 20s and into the 30s before people do end up getting diagnosed with depression. And it's usually when they just get so tired and so fatigued, they don't know what's going on, and they finally will reach out and see their family doctor, or, you know, make an appointment with a practitioner, because they don't understand why they just can't seem to function. And that's usually when depression gets diagnosed, but it usually starts to onset in the teenage years. So important to note, okay? So if we take a look then at some of the myths and the facts about depression, you know, we are talking about it a lot more. We have a lot of anti-stigma campaigns. We have our big Bell Let's Talk Day at the end of January every year, where for one day, everyone's talking about mental health. So we're starting to decrease the stigma around it. We are starting to open up those conversations, but we still have such a long way to go with this. Many people believe that when they're seeing, so think about those signs and symptoms. If this was a colleague, if this was a family member, if this was somebody that was in your circle, you might think the person was lazy or unmotivated, that they just don't maybe care about the job, that they don't care about what's going on, that they don't care about the friendship, they don't care about the family. People aren't lazy. They might be unmotivated, and that can be part of depression. But it's not laziness. It's not something that people can just get over, okay? It's a brain illness. Just like we have a physical illness, depression is impacted by those chemicals in your brain, okay? Stressful events can be a determinant of depression coming on. It can often follow a stressful life event. Coping mechanisms can come into play. It can follow illness at times. But again, it is a chemical imbalance in the brain. And oftentimes it has to be treated, needs to be treated, whether medically or by doing things to help yourself feel good. It typically doesn't just go away, okay? Depression isn't something that only happens to you if something bad happens to you, okay? Again, it can be a trigger for sure, but there's all kinds of things that can bring on depression for individuals. Vitamin deficiency during childbirth, vitamin deficiency in pregnant women can be something that brings on a depression, okay? Sometimes there's no reason. Sometimes depression can just be something that people end up with, but it really does need a proper diagnosis. Okay. Okay, if you can't get over depression, you're weak. Okay, again, it's an illness, brain chemistry. People can't force themselves to get over it. In fact, people will often describe depression as being like a big, heavy blanket that is weighting them down, and they just can't seem to push that blanket off. I have had people describe that it's like being between or behind these walls that you just can't seem to push past. You're just enclosed in this space and you can't seem to get past it. So it's no different than another physical illness that needs treatment, right? You just can't make something like heart disease go away. You can't make, a broken leg go away. You need to have it treated. And it doesn't mean you're weak if you can't get over it. It's not something you get over, okay? Again, only people who have major depression or thoughts of suicide need medication. And I'm not advocating for medication, and I'm not against medication, but sometimes people are helped by taking medication, okay? People believe sometimes, again, that treatment doesn't work, that there's nothing that's going to help, that you can just wait it out and that the depression will go away. Again, most people respond well to treatment if they get the proper treatment. The longer it goes on, the more difficult it can be for people, the more work it might take to, manage the depression. But many, many, many people do function on a day-to-day basis. They go to work, they go to school, they function within their families, and they're able to manage depression. So people can and do recover. Okay, some people live with depression for a lifetime, and again, they learn to recognize what the triggers are. They know when depression is coming on, and they can do something to help mitigate that. If they're taking the steps and they're, kind of ahead of it, they can oftentimes help themselves before that depression becomes too severe that they're not able to get out of bed.
Cheryl, one question. It's Megan here.
Yes.
There's a question that came in around depression, actually. And one of the question was around, is depression cyclical? So if someone is deemed depressed, does that mean that they are sick? It is a cyclical thing, or are they depressed all the time? Or are there variations of that?
Yes, that's a great question. There definitely are variations to depression. For individuals, people can go for long periods of time and not have a depressive episode. And then they might be in a depressive episode for, a period of time. It could be a couple of months. The cyclical part with depression is usually around something like seasonal affective disorder. So you feel well, when the sunlight's there, you feel unwell in the winter, and it's sort of the same, right? Year after year after year. Depression itself is not necessarily cyclical. People can, as I said, it varies with each individual. No two people are the same. If we were to look at something like bipolar disorder, so that's when there's depression, has to be present in order to have a diagnosis of bipolar disorder. But you also would experience a period of normal mood where you wouldn't have the mania and you wouldn't have depression. You would have normal mood. And then at some point you would experience a manic episode, and that can be years. Again, that's a whole nother topic, but that can be years between somebody having depression and then having mania. So that can also be very difficult to diagnose, but depression itself is typically not cyclical unless it's seasonal affective disorder. There's definitely variations. Did that answer the question? Okay. Oh, look at that sunlight. Okay, we're going to take a look at managing seasonal affective disorder. Okay, we see that sun up there. All right. Okay, ready to click through. Okay. Looking at the treatments that are most effective for seasonal affective disorder, and people may have heard of this, and if people on the webinar experience this, you might have heard of light therapy. This is where, and again, this doesn't mean kind of going to a tanning bed, which is what people used to do at this time of year when we were lacking sunlight. There are big lights that you can buy, and there's different sizes of lights. It's almost like a light box that you can put on, and some people believe it's most effective to do it in the morning. So as you're getting up to, sit and have your breakfast or start your day, have your coffee with that bright light. Recommended usually 30 minutes to an hour to sit with that light. That kind of gets that biological clock moving and helps us manage the seasonal affective disorder. So that we call that like a bright light treatment. There's also something called a simulation, and that's where it would be a light that sort of starts to come on slowly in the morning. It's almost like an alarm clock where it would come on slowly, 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 and then eventually would be a really bright light that would be in your room. And again, it's believed that when people wake like that, because we know how dark it is in the morning in the winter months, that when people wake like that, it can be very, very helpful. Some people will put those lights on their desk and they'll have it on for a good part of the day. Again, morning, it really is when it's believed to be one of the most effective times to have that light shining, but that is one of the things that helps with seasonal affective disorder. Again, it gets that serotonin production going in your brain. Counseling, so reaching out to your employee assistance program, your EAP, cognitive behavioral therapy. This is what is used to help with those negative thinking patterns, those negative thinking distortions that people have. What it does is it really works with an individual to change those negative thinking patterns into more realistic thinking. So we know that when we, again, spin those negative thoughts through our head, most of the time, almost all of the time, those thoughts that we have will never come to fruition. They're not true and they're not realistic, most of them. So that cognitive behavioral therapy is something that individuals can do, and it's believed to be one of the most helpful things for depression overall, is to work with a therapist who practices cognitive behavioral therapy, or there are a lot of self-help strategies that people can do to help themselves change that thinking pattern. There's a really good Dr. David Burns. He's kind of the cognitive behavioral therapy guru, and he has a book. It's called Feeling Good, the New Mood Therapy. And again, it helps us look at those most common thinking distortions and turn them into realistic thoughts for ourselves. Okay, so counseling is one of the things that's very helpful. Antidepressants, again, might help people who have seasonal affective disorder. Something that you would speak to your doctor about, potentially, and sometimes even a small dose can be helpful to people. And as I said, I don't advocate for medication. I'm not against medication. I think oftentimes the combination of things like, an antidepressant maybe, and cognitive behavioral therapy, maybe along with light therapy, right? So it can be that you have to work with all of those options to really feel good. Exercising is one of the best things that you can do for yourself. When we talk about that serotonin being produced, we know that with exercise, that's what happens, right? We start to feel good, we feel better about ourselves. Getting outside in the daylight hours, going for a walk, 30 minutes to an hour once a day to get outside is one of the things that can help people feel less depressed. Okay, again, early morning, really helpful. It gets you sort of moving and sets the tone for the rest of your day. So those are some of the things that are the most helpful when we talk about seasonal affective disorder.
Cheryl, this is just Sherry.
Yeah, hi.
So, hi. So if someone wanted to get one of those light boxes or simulations or something like that, I've also heard that salt lamps help with this type of thing. Where would they go to get that type of thing where they could just do that, where they could put that in their room and help themselves?
Costco. Okay. Costco sells the lights. Amazon is also a good place to look for them. Really, if you were to Google, light therapy lamps for seasonal affective disorder, you could come up with a number of places that you would be able to pick those up. But I know that people have purchased them at Costco. When I do some of my mental health training, I've had people come into the room, bring it, after we sort of talk about depression on day one, they come into the second day with, they have, and not everybody does, but some people, with their big lights, and they are quite big, and they sit there they use them on the lamps. So you really can just Google, but I know Costco does sell them as well.
Okay, thank you.
Yeah, you're welcome. Lots and lots of things that you can do for self-care, and this is for things that we would promote on a regular basis that you do to help maintain your wellness. But particularly with seasonal affective disorder, there are some things that, they seem pretty easy and pretty simple, but we might not think about them. We look at, if you can set yourself up by a window, and I know that's not always possible for people in a workspace, but if you can work near a window during the day, try to do that. Keep the blinds open, keep those, the window, sit near the sunlight if you possibly can, right? Get out and walk during the day. Taking a vacation, right? That, again, lovely if we can do that. And people that do experience seasonal affective disorder who go someplace sunny in the winter, sit on a beach, have that sunshine, experience really highly increased moods when they come back. Research has, they've done a study with individuals, and that really is something that's very, very effective for people. Not possible for everybody. So that's something, if you're able to do it, that people do find really helpful. Getting outside, taking on a project, right? Find a hobby, find something to do during those winter months. It might be inside, but it's something that you've got that you can look forward to doing at the end of your day, rather than coming home and just kind of sitting, with that lack of motivation, sitting on the couch and turning on the television. Find something that keeps you active. Maybe that's something you can do with your children or a partner. But, maybe you're going to sand, a dresser that you've had sitting around, or, you're going to take on some scrapbooking, or just something fun that you can focus on to keep yourself active and keep yourself busy. Okay. Volunteering, right? Getting out and doing something once a week, knowing that you've got people that are relying on you to be at a particular place can be, again, really helpful, especially with that low mood and that low self-esteem that we might experience. Try to surround yourself with positive people. All right. It can be easy, again, during those winter months to just feel low, but really try to surround yourself with positive people. Learn to say no. Delegate. If you're feeling overwhelmed, if you're feeling like you have too much on your plate, be okay with saying no, right? You don't have to be the person that takes on all of those tasks. You don't have to be everything to every person. Take some time out of your day for yourself. Okay, delegate responsibility, and this can be in your work life, in your home life, and even in your social life. Okay, you don't have to always be the one making the plans and taking on everything. Set really small, attainable goals for yourself. Okay, if you know that you want to get something done, maybe it's clearing a room in your house, maybe it's decluttering, getting rid of clothes, whatever that is. Set those really small, attainable goals. And that can be a great winter project, is really to declutter your home. Set up one thing at a time. Make a list of those things that you want to get done. And, okay, today I'm going to do this closet in this room, right? And that's all I'm going to set for myself. You might find that you end up doing more than that, but if you set those small goals, I heard somebody say one time, if they set a goal of doing one box a day, right, to try to get rid of one box or unpack, just one thing, give it to Goodwill, get rid of it, but try to set those small goals for yourself. Again, limiting sugar, eating well, avoiding substances, alcohol, other substances. Again, a lot of people will cope or use those to cope as a mechanism, but for somebody that's feeling depressed and already feeling low, alcohol is a depressant, and a lot of people don't know that. They will drink to feel better and feel like they're increasing their mood, but it actually is a brain depressant, as are many other substances. Cannabis also can be a brain depressant, can make people feel worse when they're already feeling depressed, can make people feel more paranoid. So again, just being aware of that and limiting or eliminating those if you're feeling down already. Spirituality, right? Committing to meditation, breathing. Again, lots of things that we can do to help ourselves feel better. Journaling and tracking gratitude. This is an excellent one, especially for people who have those negative self-statements, that negative self-talk, who aren't feeling very good about themselves. The more we think about things, the more it tends to bring us down. If we can get those thoughts out of our head, get it onto paper, get it out of there, there's something so powerful about that, because then we're not, we can rip it up, we can burn it, we can shred it, we can do whatever we want with it after we've taken it out of our brain and put it onto a piece of paper. As I said, most of what we think never comes true. And if we track our gratitude, so if you try this when you get up in the morning, have a notepad sitting beside your bed or having beside your coffee maker, think about 5 things every morning that you're grateful for, right? Think about whatever that is. And that, again, can be something that sets the tone for our day when we start to track gratitude. We all have so many good things in our life, but we tend to not think about them. It can be something so small, as I'm grateful that I have my pet, right? I'm grateful that I was able to put 2 feet on the floor this morning, right? I'm grateful that I have coffee to drink, little things like that. And if we can track those gratitude statements every morning, that can be something that helps us again as we set our day. I'm sure there's many, many other things that we can do as well. Okay, getting outside and going for a walk. Okay, and again, just a little slide here to remind us that it's good for us to do that. Okay, all right, how are we doing for time? We are almost at 8 o'clock. I want to leave you finally with some resources, and then we can look at some questions here. And if anybody has resources that maybe they're aware of that they want to add to this list, we can take a look at that as well. Now, I'm not sure who's all on the call. I think we might have people right across the country, maybe as far even as the West Coast, Vancouver. This top resource is specific to Ontario. It's called Connects Ontario, and it's a provincial number that's available 24 hours a day. This resource has thousands of the database has thousands of resources that are related to information on mental health services, addiction services, and problem gambling services. So it doesn't matter where you are in Ontario, if you call that number and you're looking for any of those resources, any crisis numbers, access to treatment beds for addiction, access to how you start the process if you want to get help with addiction, you can phone, you can chat, and you can email. Okay, this service is funded by the Ministry of Health and Long-Term Care in Ontario, and as I said, it's there 24 hours, so you don't have to necessarily know what your services are in your area. If you call that number, they're going to be able to help you figure out what that is, so that's a really good resource. Many people aren't aware that there is again in Ontario, a post-secondary helpline called Good to Talk. So for any person who's in college or university in Ontario, there is a 24-hour line with counselors who are available to support that individual. Okay. Distress and Crisis Ontario, again, a list of 24-hour distress lines and crisis centers in Ontario. You can also search distress centers in the Vancouver area. In fact, there's distress centers right across the country. I know that. You just would have to do a Google search for that, and you would be able to pull that up. There's a free online psychotherapy option. It's a partnership with the Canadian Mental Health Association, and it's called Bounce Back Ontario. This is something that's being funded by the Ontario government. It's partly self-help. It's partly access to a mental health professional. If you get registered, they will send you a CD. They'll send you a whole kit for you to do some self-help tools on, again, counseling, cognitive behavioral therapy. So that's a free online resource that's available for people. The Canadian Mental Health Association. This is a Canada-wide service. There are Canadian mental health associations right across the country in every major city, and oftentimes there are satellite offices. that are connected. They tend to be the organization that will have your crisis line, so your 24-hour mental health crisis line, your 24-hour mental health crisis team is usually connected to a Canadian Mental Health Association. So again, check the websites out. They're right across Canada. They tend to be the organizations that will also have support groups around mental health. They'll have support groups oftentimes for family members who are living with somebody who has mental health concerns. And a lot of times they'll have peer support groups. They will have suicide, after suicide loss support groups for people as well. So really great resource. They tend to be the main organization in the communities right across Canada. The Mental Health Commission of Canada, again, they are a catalyst for anti-stigma campaigns. If you check out their website, you're going to find all kinds of resources on there around breaking down stigma, around implementing programs, around busting myths around mental health, and services and support. So that's a really good tool, again, Canada-wide. Locally, we have the Centre for Addiction and Mental Health. Well, I say, if you're looking to access online information on mental health and addictions, this is an excellent site for anybody. So not just, they're based in Ontario, but the site itself is, so they're research, they're one of the leading training facilities, research facilities around mental health and addictions, and the information that you'll find on the website is, again, it's verified and validated. So that's a good website to check out. Mood Disorder Society of Canada, again, Canadian-wide, great resources. They also have a peer warm line, support line that runs from Monday to Friday during regular business days. thinkmentalhealth.ca, again, an excellent online resource for workplaces, and again, a lot of good resources on there. Kids Help Phone, Canada-wide, available to youth up to the age of 20. I should say youth, it's for kids from ages 5 up to the age of 20. They have professional counselors on the line to speak to young people. They also have a chat service that is now available, relatively new. I believe it's now 24 hours a day. It used to be just certain times of the day in certain provinces, but I believe the chat service for young people is now 24 hours a day as well. And I can't see, what have we got at the very bottom? I can't quite see that on my screen. Under Kids Help Phone, somebody help me out. Can you see that?
It says, Sherry, it says the Canadian Association for Suicide Prevention.
Right, okay. Yeah, I can't, it's cut off at the bottom of my screen. So yeah, that's again, a great website to go on and find your local crisis numbers and also information on suicide prevention right across Canada. So there we have it. There are a number of services and supports that are out there, and I can't stress enough to organizations to access what you have in your workplace, access your employee assistance program. They will also have a list often of counselors and services and supports that you can reach out to. EAPs tend to be available 24 hours a day for most companies as well. So access the services that you have within your own workplaces. And I believe that's going to kind of bring us to...
That's great, Cheryl. Thank you so, so much. That was an excellent discussion on a very important topic, seasonal affective disorder. So we do still have a couple of minutes here as we tie up. The questions you can absolutely ask. You can either see a little hand by your name. We can try to get you on live to ask Cheryl your question. You may also type in your question in the chat box, and we'll be monitoring those for the next couple of minutes. Cheryl, there's actually been one come through.
Okay.
So one of the questions was around, again, teen depression.
Yes.
Are the teen depression rates increasing in our communities? And if they are, what would you think would be the main reason for that?
That's a great question, and it's one that comes up often, particularly around depression and anxiety. And I can only, rates of depression, we're talking about it more. So I don't know for certain if the rates are increasing or if it's because we are encouraging people to come forward and to talk about their mental health concerns, and we are now recognizing that depression is a real illness. There's definitely a higher rate of reported incidents for sure, and I would say yes, amongst teen there definitely is a higher incidence of reported numbers of depression. Reasons for that, I think there's several, and again, some of this is kind of my own information and you know what I'm seeing, you know, in circles. Social media, for sure, is a contributor to the higher rates of anxiety and depression amongst young people. A lot of reasons. We know that young people are on screens for extended periods. It's impacting sleep, it's impacting how we view ourselves, it's impacting how young people view themselves. There's a lot of comparison to what they're seeing on social media. We have instant access to information. We compare ourselves, you know, to our friends who look like they've had, you know, they're having the best vacations, they've got the best family, they've got the best boyfriends and girlfriends and circle of friends. Which again, we know that people really only post their best pictures, so it's not reality. But we're living in this this world where we're on social media all the time. Video games, and this has been researched and verified, the use of screens is changing the frontal lobe of the brain. So for people, and this has been years now, that young people, right, are on video games and they're playing online games and they're in front of computers. That access and that constant screen time is changing the wiring in the brain, in the frontal lobe. And again, I'm not a medical practitioner, but I know that this is what research is showing. And as I look at the brains of young people developing with mental illness, again, with depression, you know, it's that increase or decrease of the serotonin, decrease of melatonin, neurotransmitters. No one factor is at play, but yeah, that's kind of a long-winded answer in terms of where we are with the depression scale and the anxiety scale in young people. It's definitely on the rise, and a few reasons, right? We're talking about it, but it's also the access that we have to that instant information, that instant comparison.
Thanks, Cheryl.
You're welcome.
Oh, I think we have another question here. Wait a second.
Do we have any other questions?
I don't think so. I thought there was, but there isn't. So if there are any questions, you can definitely reach out to any of us. Actually put Cheryl's last slide up here. So definitely reach out to any of us. This is Cheryl's email. You may also find anybody in your organization that is with Employee Wellness Solutions Network. You can definitely ask any of us, and we can get the answer for you. You can also email us at info@ewsnetwork.com, and we can definitely ensure that your questions are answered. I think that's it, Cheryl. Thank you so much for all of your time and your wisdom tonight. I thought the presentation was excellent and lots of really great information. And I'd love to thank everybody for being on the call tonight. Apologize for a small technical glitch at the very beginning, but we got started on time, so no problem. It sometimes happens. So Cheryl, thanks so much. And I really appreciate you and your wisdom and your professional insights. Thanks so much.
Thank you very much for having me, and I hope it was informative for people. And again, if you have any questions, there's my information as well, and happy to answer anything.
Thank you as well, Cheryl, for having me on as well. Thanks.
Thanks so much. Really appreciate the opportunity.